Hi everybody, welcome to Dr. Manny's YouTube Learn Shops, and what we'll be looking at in this presentation is health assessment, in particular the integumentary system. So just as a review activity, are you aware of 4 clinical manifestations of an integumentary system anomaly? So if you have something abnormal on the skin, you should be looking at what colour it is. Does it have a temperature, which means possibly it's warm? What's the condition of the skin? Is it dry or is it sweating? Are there any rashes, lesions, any hair loss, such as in balding or alopecia? Is there any dandruff, and what's the condition of the nails? Remembering that what you see, inspection, is what you know. If you don't know what normal is, you won't be able to identify what abnormal is. So when it comes to the physical assessment, the integumentary system consists of the skin, the hair, and nails. And some of the major functions of the integumentary system include protection. It's your first line of defense. The skin, for example, sensation to touch produces vitamin D, and temperature regulation through vasoconstriction and vasodilation through the skin. And also excretion of certain products that you may not require, such as sodium or water, as we lose when we sweat. Some of the important things related to all systems are family history. So when it comes to the integumentary system, questions could include, do you have any family members with a history of skin, hair, or nail anomalies? And if so, who had the problem? And if so, what was the problem? And there are numerous disorders that could be identified, which could now be genetic and transferable in a family. Past history is also important. So what's the past medical history, or even possibly the surgical history? And questions could include things such as, do you do a self-examination every month? Do you look for abnormalities in your skin? And if so, when was your last clinical skin examination, either by self or possibly a professional? Do you have any skin lesions? If the answer is yes, how many? Where are they? Have they changed? Medication history is also important because you could be taking over-the-counter medications or prescription medications, and these could have an effect on your hair, skin, and nails. Questions could include, do you take any medications for your skin, hair, and nails? And if so, what are they? Why do you take them? If prescribed, who prescribed them and why? Lifestyle behaviour is also important. So questions could be, what's your occupation? What are your hobbies? Because again, there could be a risk associated with things like skin cancer. And questions could include, are you exposed to excessive sunlight or other sources of radiation? How do you protect yourself against excessive sun exposure or these radiation issues? You can also break down who could be at risk of having a skin issue. So questions could include, do you have diabetes mellitus? Do you have any peripheral vascular diseases? Do you have any known sensory loss? When it comes to the physical assessment, as we've mentioned in other learn shops, there can be subjective and objective assessments. And some of the subjective assessment questions could be, are you currently experiencing any itching, rashes, or unusual moles, lumps, bumps, or nodules? Have you ever been diagnosed with acne, eczema, skin cancer, pressure injuries, jaundice, edema, or lymphedema? Are you currently using any prescription or over-the-counter medications, creams, vitamin supplements to treat skin, hair, and nail conditions? So the objective assessment would involve inspection and palpation. So on inspection, you would be looking for the colour of the skin, the hair, and the nails. You'd be looking at the scalp, and again, in respect to skin and hair. You'd be looking at now for lesions on the skin and if there was any skin breakdown. On palpation, you'd be utilising temperature, moisture, texture, capillary refill time, skin turgor, and whether there was any edema. Some of the common signs and symptoms, clinical manifestations that relate to the integumentary system could involve the rash, lesions or wounds, whether there's any itching, pruritus, and look at the images. The images are all anomalies. But in order to identify them, you've got to be aware of what is normal. If there is a rash, you should be able to describe the rash. If there are lesions, are they acute or are they chronic? If there's itching, how long has this been going on and where exactly is the itching? Primary lesions of the skin could include macules, patches, papules, plaque, a wheal, a nodule, a tumour, a vesicle, bulla, a pustule, a cyst. And these we will review in other learn shops. But there's nothing to stop you from reviewing them now. Now, when it comes to secondary integumentary system lesions, this is some of the terminology that we will be reviewing in other sessions. Things that relate to atrophy, scarring, keloid tissue formation, fissures, excoriation, erosions, ulcers and crusts, scale and lichenification. All important terminology to be aware of and understand. Then it comes to things like cancers or skin tumours and growths. And these could include moles, skin tags, lipomas, lentigos, more seriously, squamous cell carcinoma, Kaposi syndrome, basal cell carcinoma, and actinic keratosis. Now, three of the most common disorders related to the skin, hair and nails are acne, look at the images, alopecia areata, atopic dermatitis, also known as eczema. When we look at some of the integumentary disorders that relate to the nails, they can have discoloration such as yellow, with dark longitudinal streaks, splinter hemorrhages, half and half nails, which are all indications of other disorders. The integumentary system is like the window to your soul. If there's something wrong with your skin, hair or nails, it probably means that there are other issues elsewhere in your body. Things like Bowes lines, finger clubbing, pitted nails, onycholysis. Okay, that's the introductory session that's ended for this Dr. Manny's Learn Shop. If you felt that it was valuable, please recommend it to your colleagues and your friends, and please subscribe so that you're notified of other Dr. Manny Learn Shops when they become available. Thank you, and God bless.